Hello, sir. This is Ankit Kumar from 3001, and today I am here to present my PPT on the topic named as the ischemic heart disease. So these are the brief contents regarding the topic. That the first one is the definition of the ischemic heart disease. Then we will talk about the history, the current situation of the disease, statistics, and the morbidity, or we can say the mortality rate due to the disease in the different countries in a comparison way. Or the next one is the legislative laws, the laws made uh, regarding the disease, or to prevent, for the prevention of the disease. Now after that, there are the preventive measures taken by the government and the people uh, for, uh, uh, for the prevention from the disease. And the program started programs started by from the government for the prevention. And the last is the conclusion and the references. So the first ischemic heart disease, or the ischemia. So the ischemic means an organ have the deficient oxygen supply or inadequate oxygen supply. For example, heart is not getting enough blood or and oxygen. As the in the ischemic heart disease, also known as the coronary heart disease or the coronary artery disease, it is the term given for the heart problems caused due to the narrowing of the arteries of the heart, or the coronary arteries, which supplies to the heart muscles. Now these are the risk factors regarding the uh, ischemic heart disease. The risk factor are divided into two types: modifiable and the non-modifiable. In the modifiable risk factors are those which can be modified, or which can be settled down to the normal rate. Or non-modifiable risk factors are they are cannot be normalized. In the modifiable risk factors, as we can see, there is the elevated plasma level, hypertension, cigarette smoking. uh, these risk factors, and further are the diabetes and the obesity. These risk factors can be avoided by changing the lifestyle. But whereas the non-modifiable risk factors are the like gender, age, and the family history. These risk factors cannot be uh, changed or modified according to our need. uh, Next is the history regarding the ischemic heart disease. In the history, the William Harvey in the 1578 to, till 1657, a physician of King Charles I, is accredited with the discovering that the blood moves around the body in a circulatory manner from the heart. In the ischemic heart disease, is defined as a history of myocardial infarction, a history of positive treadmill that results use of the nitroglycerin, chronic stable angina, or an ECG with abnormal Q waves. And another scientist is the Friedrich Hoffman, which was born in the 1660 and died in 1742, was a chief professor of the medicine at the University of Hull. He noted later that the coronary heart disease started in the reduced passage of the blood in the coronary arteries. According to the book Drug Discovery, Patients, Processes, and Perspectives. And the further in the history, Walker announced was met with the guarded enthusiasm. Not everyone was certain whether the decline was real. The further is the here I got the chart regarding the uh, condition of the disease in the from 1954 till 2009. In the 1954, the, this chart is according to the number of death in 1 lakh of population in different years. Now, in the 1954, there is a first open heart procedure uh, in by Gibbon. And after that, in 1958, there is a coronary angiography developed. Further in the different years, there is a progress regarding the cure or the treatment of the disease. In the in 1980, the first in implantable cardiovascular defibrillator developed by the Microvisky. And in 1993, there is a superiority of the primary PCI versus fibrinolysis in acute myocardial infarction noted. Further, in the 2009, there is a left ventricle assist device as a destination therapy is advanced heart failure shown to be effective. Further, there is a this is the chart regarding the deaths of the ischemic heart disease, which is published in 2016. And on the x-axis we can see the different country names, and on the y-axis there is the number of deaths per 1 lakh inhabitants. In the first in the chart we can see the different countries. First of all, uh, the the countries with maximum death are the like countries Hungary, and the minimum death countries are the in the last we can say like the France. Now the current situation regarding the disease is in 2016, the established prevalence of the cardiovascular disease in India was estimated to be 54.5 million. One in the four death in India are now because of the cardiovascular disease, with ischemic heart disease and stroke stroke responsible problems. And for more than 80% of the burden, it is not in control, then in India ischemic heart disease is come in first position. Now there is a central illustration regarding the cardiovascular disabilities, and this is a chart regarding cardiovascular disease attribute to the behavioral risk factors by like in the both sexes, age standardization, and number of death per 1 lakh people. Now, likewise, in the this chart is regarding the physical activities or the risk factors like tobacco or the dietary risk. Talking about in the 90s, in the 1990s, uh, there is very low physical activity. There is a high dietary risk. Uh, High dietary risk are there, and also till now there are the more risk is due to the there are the diet problems. In the this chart is telling about the uh, below we can mark the indication like in the United States and in India, the dietary risk are more in the India as compared to the United States, and the for another is the globally. uh, Also, the tobacco smoking risk are also more in India than the United States. Until now, the same pattern is followed. Now, till now, the also in India, the dietary risk mm, is a major problem regarding the ischemic heart disease, whereas in United States they are recovering towards this problem. The next is the death of the peoples uh, according to the age group in different countries like in the UK, Brazil, USA, Kazakhstan, and in the Ukraine. As we can see in the chart there, likewise in the Kazakhstan, there is a more death of the people who are above the age of 80. And like in the chart we can see the marker indication there. The blue chart is for the males, and another one is for the female. Likewise, due to the ischemic heart disease, the males are uh, more prone to be dead. Likewise in the Kazakhstan, talking about the Kazakhstan, in the peoples above the 80 years of age, males are died near about 1200, and the females are about 800. And also we can talk about the USA, then also there are the more males are died due to the heart disease than the females. Now the statistics in the statistics, there is a 23.8 million, or the 95% prevalent cases of the ischemic heart disease were estimated in India in 2016. And 6.5 million or 6.3 to 8% of the total population prevalent cases of the strokes are also recorded in India. It is a 2.3 times increase in both the disorders from as compared with the 1990s. Now the morbidity, or the we can say the mortality rates due to the ischemic heart disease are as follows. Like the in the coronary cardiovascular disease remains the leading remains the leading cause of the death globally, including in the India and other countries like the United States. And in 2016, there were an estimated 6.62.5 and 12.7 million years of life lost prematurely due to the cardiovascular disease in India and the United States, respectively. Ischemic heart disease and stroke were estimated to account for approximately 15% to 20% and 6% to 9% of all the death in all these regions. Now, here is the stroke-related death are more concentrated with the death caused with the coronary heart disease. This is this is regarding the India. It is a comparison between the coronary heart disease or the stroke related death in India in the years 2010 and 2013. Likewise, below we can say the mortality rate per 1 lakh as marked in the different colors. There are the as more than 190 deaths are seen like in the states of India like Punjab and Haryana, and also in the Karnataka, Andhra Pradesh, and Tamil Nadu. Less than 60 are seen in the Chhattisgarh, and also in the Manipur, Mizoram, Nagaland. It is not marked in here, but in the on the other side, stroke related, we can say that in the Nagaland, Manipur, Mizoram, and Arunachal Pradesh, there are less cases of coronary heart disease. But as we can say in the stroke related, there is more cases of stroke in these states like Arunachal Pradesh, Nagaland, Manipur, Mizoram, Tripura. Uh, Next is the cases of the ischemic heart disease and the stroke are also compared in this chart. Likewise, in the ischemic heart disease, is according to the sexes age standardization, and in the year 2016, and the death of the people per 1 lakh, and there is a marker indication below uh, according to the color coordination. These are the number of deaths of the people in both of the cases in the stroke and the ischemic heart disease. And here we can see we can also see the deaths in the annual percentage. In the percentage wise, we can see the deaths here, and on the above we can see in the A and B we can see the number of deaths, and on C and D we can see the percentage of the death according to the different color combinations. Now the different legislative laws regarding the given by the government regarding the disease, there is a practice of the cardiology is increasingly constrained by the guidelines, regulation, and legal consideration. And the cardiologists, like any other group of doctors, have a primary duty of care to individual patients, but also have wider responsibility to the society in general, to the situation, and to their colleagues. The all the cardiologists and trainees must be very aware of the duties and the responsibilities, and uh, they should know the proper information or the proper knowledge regarding the disease, and they should also know about the living habitat and the the generics and other types of medicines. Now the preventive measures taken by the government and the peoples for avoiding the disease, like uh, there are the many risk factors regarding the disease, like as I said before, the non-modifiable risk factors are the age age and gender, and the modifiable risk factors are these are the tobacco use, physical activity, excessive alcohol consumption, unhealthy diet, obesity, generic predisposition, and family history is another non-modifiable risk factor. So these risk factors which can be modifiable are the tobacco use, physical inactivity, excessive alcohol consumption, unhealthy diet. And also the other risk factors are the raised blood glucose, like the diabetes mellitus, raised blood cholesterol. And also we can avoid by the lifestyle changes, such as eating a healthier food and low sodium, lower fat diet. And also the medicines have a great role towards the disease, like the medicine to treat the risk factors for the cardiovascular disease, such as the high cholesterol, high blood pressure, or any irregular heartbeat. Medicines can also alter this disease. Now there is a chart regarding the prevention of the disease. There is a, we can say, the health sector in the comparison with the health sector and the population at the risk. So primarily there is a primordial prevention is the prevention of the diet and the lifestyle. The second another prevention is the primary prevention, or there is a medical management of the cardiovascular risk conditions. In this there is a cardiovascular disease risk condition. In this, the health service for the acute and chronic, there is a hypertension, type 2 diabetes mellitus, hyperlipidemia, chronic kidney disease. These are the risk condition. And the secondary prevention of the conditions are the health service or the acute chronic. In this, there the ischemic heart disease, cerebrovascular disease, heart failure. Uh, Regarding these disease, there will be there must be the secondary prevention management. Now the programs held regarding the management of the disease are an important component. The programs are the important component of the prevention and the control of the cardiovascular disease is a in a integrated community based programs on the prevention of the chronic disease, and which help in reducing the cardiovascular risk factors and in both the social and economic determinants. And these programs are also held for the awareness of the people regarding the disease, and uh, for the prevention, like through the programs the people can get the dietary information and the information regarding the exercises for for avoiding the such type of disease. Now at last the conclusion, on an individual level, chronic heart disease continues to take a toll on the number of life lost and on the quality of the life for the survivors of the cardiac events. The economic burden of the individual and to the society will continue to grow unless the disease is controlled and or prevented. We all should have the stay aware of our body, like that we have keep up the checkup, and we should take the healthy diet regularly. And further there are the references regarding the presentation. And thank you.